Most people believe that if a doctor recommends surgery, it must be the right decision. It feels logical, it feels safe. But after 60, that assumption can quietly lead you into risk. Because the biggest problems often don't happen in the operating room. They happen after, during recovery, and you don't feel it coming. No warning, no clear signs. In my experience, I've seen patients walk into procedures they were told were routine, only to lose strength, mobility, or independence weeks later. Not because the surgery went wrong, but because their body couldn't recover the way they expected. And this is where it becomes dangerous. The focus is always on getting through surgery, rarely on what comes after. So before you say yes to any procedure, you need to understand what could happen after you walk out of that operating room. But here's where most people get this wrong. You might be thinking, if a surgery is common, it must be low risk. That's what most people believe. It feels logical. It feels reassuring. But this is exactly where many people make a decision they later regret. Because the truth is more complicated than that. Risk does not end when the procedure is over. In many cases, that is when the real challenge begins. Recovery is where older adults face the greatest strain. Strength can drop faster than expected. Confusion can appear without warning. And small complications can quickly turn into serious setbacks. But this is the part that often goes unspoken. The focus is usually on fixing the problem, not on preparing you for what your body will go through afterward. So the real question is not just about getting through surgery, it's about whether your body is ready for everything that comes after it. I have worked with older patients for years, and I've seen a consistent pattern. People are told a surgery is routine. They feel reassured. They go in expecting a quick recovery. But weeks later, they struggle with weakness, memory issues, or infections they never anticipated. Families are often surprised. They say, "No one told us this could happen." But it happens more often than you think, especially after 60, when the body does not respond the same way it once did. This is not about fear, it's about clarity. Because when you understand the full picture, you can ask better questions, make better decisions, and avoid outcomes that could change your independence. When your body goes through surgery, it's not just a procedure, it's a full body shock. Every major system is pushed at the same time. Your heart works harder to keep circulation stable. Your lungs may struggle to maintain oxygen levels. Your kidneys are under pressure to process medications and waste. And your brain becomes more sensitive to anesthesia and inflammation. In a younger body, this stress is often absorbed and gradually resolved. But after 60, things change. The body has less reserve, less ability to recover quickly. Even if you feel healthy on the outside, your internal systems may not respond the same way. And this is where it becomes critical to understand something most people miss. Two people can go through the same surgery, but experience completely different recoveries. And that difference can decide whether someone regains independence or slowly loses it. Think about someone being advised to undergo open heart surgery. They're told it will restore blood flow and improve quality of life. It sounds like the right move. It feels necessary. Most people hear this and think, if the heart is the problem, surgery must be the solution. But what almost no one explains is this. The surgery itself is only one part of the journey. And this is where everything begins to change. The real risk often starts after the operation is over. Because that's when the body is pushed into a recovery phase it may not be prepared for. The heart is healing, but so are the lungs, the immune system, and even the brain. And in older adults, this recovery phase can become far more demanding than expected. Breathing can become difficult, fluid can build up, weakness can set in quickly, and sometimes confusion or memory changes appear days after surgery. Here's what most people don't realize. During major surgery, the body releases stress hormones and inflammatory signals. In a younger person, the system absorbs this shock and gradually returns to normal. But after 60, the same response can overwhelm the body's reserve. The lungs may not expand as well, increasing the risk of infection. The brain becomes more sensitive to anesthesia, leading to what we call post-operative cognitive decline. Studies have shown that a significant number of older adults experience some level of confusion or memory loss after major surgery, especially cardiac procedures. And this is where things begin to change. Recovery slows. Independence becomes harder to regain. Simple tasks feel exhausting. But it gets worse. When recovery is delayed, other risks begin to stack. Staying in bed longer increases the chance of blood clots. Reduced movement weakens muscles rapidly. The immune system becomes less effective, making infections more likely. Emotionally, this can be difficult. Patients who expected to feel better may instead feel trapped in a slower, more fragile state. Families often struggle to understand why progress is not happening as expected. The important part is this: there are often alternatives that are not fully explored. Less invasive options, like catheter-based procedures, can sometimes achieve similar results with lower recovery stress. Medications and lifestyle adjustments may also play a role in certain cases, but these options are not always discussed in detail. So before agreeing to a major heart surgery, one critical question needs to be asked. What will recovery actually look like for someone like me? And are there safer alternatives that reduce that burden? Imagine being told you need spinal surgery for back pain or nerve compression. You've tried medications, maybe some therapy. The pain is still there. So surgery starts to feel like the next logical step. It promises relief. It promises stability. And for many people, it sounds like a permanent fix. But this is where expectations and reality start to separate. Because the spine is not just a structure. It is deeply connected to movement, balance, and coordination. And when that system is altered, recovery becomes more complex than most people anticipate, especially after 60. And this is where a long-term problem can quietly begin. At first, everything may seem straightforward. The procedure is completed, the problem area is addressed. But then the recovery phase begins. Muscles around the spine weaken quickly if movement is limited. Pain can persist, sometimes shifting to new areas, and the body must relearn how to move properly again. In older adults, this process is slower. Coordination declines, balance becomes less stable, and even small setbacks can delay progress significantly. Here's what most people don't realize. Spinal surgery does not always remove pain the way people expect. In some cases, it changes the mechanics of the spine, placing stress on nearby segments. This can lead to what is known as adjacent segment degeneration. Studies have shown that a notable percentage of patients may need additional procedures within a few years, and this is where it becomes dangerous. One surgery can quietly lead to another, creating a cycle that becomes harder to break as the body ages. But it gets worse. Limited mobility after surgery can trigger a chain reaction. When movement decreases, muscle mass drops rapidly. This condition, often linked to age-related muscle loss, makes recovery even harder. Walking becomes slower, confidence drops, the risk of falls increases, and emotionally, this can feel frustrating. Many patients expect improvement, but instead find themselves dependent on support for longer than planned. There are often alternatives that deserve more attention. Structured physical therapy, targeted strengthening, and pain management strategies can sometimes provide meaningful relief without the same level of risk. In some cases, less invasive procedures may also be considered, but these options require time, patience, and the right guidance. So, before deciding on spinal surgery, one question becomes critical. Am I choosing this because it is truly necessary, or because I haven't fully explored safer ways to manage the problem? Consider a situation where someone is diagnosed with cancer, and surgery is presented as the main treatment. It feels urgent. It feels necessary. Remove the tumor, solve the problem. That's how most people understand it. And in many cases, surgery can be life-saving. But there is another side to this decision that often gets overlooked. After 60, the decision is not just about removing the disease. It is about how the body will handle everything that comes with that decision. Because cancer surgery is often more extensive, longer procedures, greater stress, more demanding recovery. At first, the focus is entirely on the tumor. Doctors explain where it is and how they plan to remove it. That part feels clear. But what is often less discussed is what happens after. The body enters a high-stress state. The immune system is temporarily weakened. Healing takes longer, and energy levels can drop significantly. In older adults, this impact is amplified. Appetite decreases. Weight loss can accelerate. Strength declines. and even basic recovery milestones become harder to reach. Here's what most people don't realize. The body's ability to recover from major cancer surgery depends heavily on its baseline reserve. After 60, that reserve is often reduced, even in people who appear healthy. Studies have shown that frailty is a stronger predictor of surgical outcomes than age alone. And this is where things begin to shift. A procedure that removes the tumor may still leave the patient in a more vulnerable state overall. Sometimes, the cost of recovery can outweigh the expected benefit. But it gets worse. Extended hospital stays increase the risk of infections and complications. Reduced mobility leads to muscle loss. And in some cases, patients may not regain their previous level of independence. Emotionally, this can be difficult to process. The expectation was improvement. The reality may feel like a trade-off. There are often alternative approaches that need to be considered carefully. Less aggressive treatments, targeted therapies, or even a focus on quality of life rather than invasive intervention. These decisions are deeply personal, but they require full understanding, not just of the disease, but of the body's ability to recover. So, before agreeing to major cancer surgery, one essential question should be asked. Will this treatment improve not just how long I live, but how well I live after it? Think about joint replacement surgery, knee or hip. It is one of the most common procedures recommended after 60. The promise is clear: less pain, better movement, a return to normal life. And for many people, that sounds like the right decision. It feels routine, it feels safe. But this is where many people are caught off guard. Because joint replacement is not just about replacing a joint. It is about rebuilding strength, balance, and movement from the ground up. And in older adults, that process is far more demanding than expected. But for some patients, the outcome turns out very different than they imagined. Instead of gaining independence, they find themselves needing more support than before. At first, everything may seem successful. The new joint is in place, the procedure goes as planned. But recovery is where the real work begins. You need strength. You need balance, you need endurance, and in older adults, these systems are often already reduced. Muscles around the joint may be weak, coordination may not be as sharp, and pain can limit how much you are able to move during those critical early weeks. Here's what most people don't realize. If movement is delayed or limited after surgery, recovery slows dramatically. Muscles weaken even further, stiffness sets in, and the joint may not regain full function. Studies show that outcomes after joint replacement are strongly influenced by pre-surgery strength and post-surgery rehabilitation. And this is where it becomes dangerous. Many patients assume the surgery itself will fix everything. But without active recovery, the benefit may be much less than expected. But it gets worse. After surgery, the body is also dealing with inflammation, blood loss, and the effects of anesthesia. This can increase the risk of complications, like infections or blood clots, especially when mobility is reduced. For some patients, the recovery period becomes longer and more difficult than anticipated. Walking aids are needed longer, independence is delayed, and frustration builds as progress feels slow. There are alternatives that are often underutilized. Targeted physical therapy, weight management, pain control strategies, and strength-building programs can sometimes delay or even avoid the need for surgery. In some cases, less invasive procedures may also be considered. So, before moving forward with joint replacement, one key question should be asked. Is my body prepared not just for the surgery, but for the demanding recovery that follows? Now consider emergency surgery, a sudden fall, a blocked intestine, a fracture, something unexpected. There is no time to think, no time to prepare. The decision is made quickly. Surgery feels like the only option, and in many cases, it is necessary. But this is where the situation becomes much more complex, because in these moments, decisions are made under pressure, not clarity, and the body is pushed into a high-stress situation without preparation. That combination alone can completely change how recovery unfolds. In a planned surgery, there is time to optimize health. Medications are adjusted, nutrition is improved, physical strength is built. But in an emergency, none of that happens. The body goes straight into a high-stress situation without support. And this is where things begin to shift. The heart is suddenly under pressure. The lungs may struggle to keep up. The kidneys may not tolerate the sudden changes in blood flow, and the brain becomes more vulnerable to confusion and delirium. Here's what most people don't realize. The stress response during emergency surgery is often much more intense. Inflammation rises sharply, hormones surge, and in older adults, this can overwhelm the body's ability to maintain balance. Studies have shown that complication rates and mortality are significantly higher in emergency surgeries compared to elective ones, especially in patients with reduced physiological reserve. And this is where it becomes dangerous. The focus is on saving life in the moment, but the aftermath can be far more complex than expected. But it gets worse. Recovery after emergency surgery is often unpredictable. Patients may spend longer in intensive care, mobility is delayed, muscle loss happens quickly, and the risk of infections increases with prolonged hospital stays. Emotionally, this can be overwhelming. Patients and families are often unprepared for the long recovery that follows a sudden event. There is one critical takeaway here. While emergencies cannot always be avoided, overall health and resilience can be improved ahead of time. Strength, nutrition, and regular medical care can make a meaningful difference if a crisis occurs. So, one important question to carry forward is this. If my body were put under sudden stress today, would it be strong enough to handle not just the surgery, but everything that comes after? Before you agree to any surgery, you need to slow the process down, not emotionally, but mentally. Because this is not just a medical decision, it is a life impact decision. One that affects not only what happens in the operating room, but what your body will go through in the weeks and months after. And when you start thinking this way, the entire conversation changes. You stop asking, "Do I need this?" and start asking, "Am I truly prepared for what comes next?" Start with the most important shift. Do not ask only, "Do I need this surgery?" Ask a better question. What will recovery demand from my body? And am I prepared for it? This changes the entire conversation, because it forces attention onto the phase that carries the highest risk after 60. Then, move to specifics. Ask your doctor, what is my personal risk based on my current health, not just my age? Frailty, strength, nutrition, and existing conditions all matter. Two people of the same age can have completely different outcomes. You need your risk explained in your context, not in general terms. Next, ask, what are the non-surgical options available to me right now? In many cases, there are alternatives: medications, physical therapy, less invasive procedures. Even delaying surgery while improving your condition can change outcomes. But these options are not always presented unless you ask directly. Then ask, what does recovery actually look like for someone like me? Not a general answer, a real one. How long will you need support? When will you be able to walk independently? What complications should you realistically expect? This prepares you for the reality, not just the procedure. Also ask, what can I do before surgery to improve my chances? This is often overlooked. Strength training, nutrition improvement, breathing exercises, and medical optimization can significantly improve recovery. This is called preparation, and it can change everything. And finally, ask one critical question. If I choose not to have this surgery right now, what happens next? Understanding the natural course of your condition gives you perspective. It allows you to weigh urgency against risk. This is not about rejecting surgery. It is about making an informed decision. When you ask better questions, you gain control. You move from being a passive patient to an active decision maker. And that shift alone can lead to better outcomes, safer choices, and a recovery your body is actually capable of handling. I remember a patient in his early 70s, active, independent. He enjoyed his daily walks, took care of his routine. When he was advised to undergo surgery, he didn't hesitate. The recommendation sounded clear. The procedure was described as routine. He believed he would be back to normal within weeks. The surgery itself went as planned. No complications in the operating room. Everything looked successful on paper. But the days after told a different story. His energy dropped more than expected. Walking became difficult. He felt confused at times. Small tasks that once felt easy started to feel overwhelming. And this is where it became difficult. Not because something went wrong during surgery, but because his body struggled to recover the way he had imagined. His family kept asking the same question. Why wasn't this explained before? They were prepared for the surgery, but not for the recovery that followed. Weeks turned into months. Progress was slow. Independence became limited. And emotionally, that shift was hard to accept. But I've also seen a different outcome. Another patient. Similar age, similar condition. But before making a decision, he asked more questions. He wanted to understand his risks. He explored alternatives. He spent time improving his strength and nutrition before moving forward. And when he finally chose treatment, his recovery was different. Still challenging, but manageable. He knew what to expect, and his body was better prepared to handle it. That contrast matters, because it shows that the decision itself is not the only factor. The way you approach it changes everything. And this is the one takeaway I want you to remember. It's not just about whether a surgery can fix the problem. It's about whether your body can truly come back from it. Let's bring this together clearly. Surgery after 60 is not just a medical event. It is a full-body challenge. We talked about heart procedures that fix one problem but strain multiple systems during recovery. Spinal surgeries that change structure but demand long rehabilitation. Cancer operations where the body must fight on two fronts. Joint replacements that require strength and consistency to succeed. And emergency surgeries where the body has no time to prepare. Each of these may be necessary, but each carries a reality that is often not fully explained. The key shift is simple. Stop asking only if a surgery is needed. Start asking if your body is ready for what comes after. Because surviving the procedure is only one part of the journey. Recovery is where outcomes are truly decided. So let me ask you something. If you were told tomorrow that you need surgery, would you ask what happens during the procedure or what your life will look like after it? Tell me in the comments. I read every single one. If this helped you see things differently, share this with someone who might be facing a similar decision. And if you want more simple, clear guidance on staying strong and making smarter health decisions after 60, consider subscribing. It could help you or someone you care about avoid a difficult situation later. This content is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always speak directly with your healthcare provider before making any medical decisions.